Electronic Committee on Health. My name is Lisa Subek, and I am here, the Executive Director of NARAL Pro-Choice, Wisconsin. I'm here today to testify on behalf of our over 35,000 members and activists statewide in opposition to SB 306. NARAL Pro-Choice Wisconsin opposes this legislation because it imposes new and unnecessary barriers for women seeking safe and legal abortion care, and is yet another example of politicians interfering with decisions that should be made privately between a woman and her doctor. Specifically, we object to the first part of the bill, which adds to the already burdensome so-called counseling requirements that must take place before a physician may perform an abortion. Certainly, we do not want to see any woman coerced into having an abortion, just as it's our wish that no woman is coerced into carrying forth an unwanted pregnancy or unintended pregnancy. Our current law already requires that a woman give voluntary and informed written consent, which is considered voluntary only if given freely and without coercion. So we question the necessity of this provision of the bill. The requirements put forth here simply add to the already lengthy so-called counseling requirements, which are really dictated and scripted by elected officials rather than scripted or prescribed by trained counselors or medical professionals. We also object to the second piece of the bill, regulating the use of telemedicine in abortion care. While this practice is not currently used in Wisconsin, nor do we know of any plans to begin its use in our state in the near future, we acknowledge that telemedicine is an emerging practice in the field of medicine as a whole, and holds promise for allowing women who otherwise have significant barriers to accessing their constitutionally protected right to choose abortion to do so with fewer hurdles. Opponents of this practice have described it as something out of Brave New World, and certainly these are the reports that have come forth in the media, where a woman goes into an empty booth somewhere in an undisclosed location, quite literally in the middle of nowhere, and converses with a doctor via webcam, then swallows pills dispensed from a tube. To the contrary, in Iowa, the only state where telemedicine is currently being used for abortion care, a woman goes into a clinic where medical personnel are present. She meets with those medical personnel and receives a sonogram and counseling prior to speaking with the doctor who prescribes the medication necessary for a medical abortion. She takes that medication at the clinic with these medical personnel still present. It's a safe procedure utilized by more than 2,000 women in Iowa up to this point, without any significant difference in side effect between women using telemedicine versus women seeing a doctor in person. The rates of successful abortion among women seeing a doctor via telemedicine also mirror those of women seeing a doctor in person. A study's been done, and actually a number of them have been done now in Iowa, but one study completed earlier this year looked at 446 women who have used this service in Iowa, and it demonstrated no significant difference in outcomes for women using telemedicine for abortion care versus those seen in person by the doctor. Dr. Daniel Grossman, who's an OBGYN at University of California, San Francisco, and was a big part of performing this research with IBIS Reproductive Health, said, our findings indicate that the clinical outcomes with medical abortion provided through telemedicine are the same as when the procedure is provided with a face-to-face visit with a physician. In Wisconsin, 94% of all counties have no abortion provider. Because of our 24-hour waiting period, women who do not live near a clinic must not only travel to receive the care, but they either need to do so twice or they need to plan for an overnight stay. This adds to the cost of abortion care, particularly for rural women and many low to moderate income women who cannot afford the additional travel costs or afford the time off work, creating a disparity in access between those who can and cannot afford safe and legal access to abortion services. Not only is this proposal to ban the practice of providing medical abortion an overreach by government into the field of medical care, it is an unnecessary regulation of a procedure deemed safe for patients who otherwise lack access to this critical piece of reproductive health care. The motive is clear. This bill is not about patient safety and only serves to diminish access to women's health care. It's nothing more than a blatant attempt by its authors to chip away at women's access to their constitutionally protected right to choose safe and legal abortion when facing an unintended pregnancy. I ask that you vote against Senate Bill 306, because it is an unnecessary intrusion by government into the doctor-patient relationship, it only makes it more difficult for women faced with unintended or untenable pregnancies to access the health care that they need. Thank you.
Questions from committee members? Senator Lazick.
Thank you. Thank you, Chair, and thank you for your testimony. What is the policy of Planned Parenthood as it relates to abortion trauma? What do you do with abortion trauma victims?
I don't work for Planned Parenthood, Senator Lazick. I work for NARAL Pro-Choice, Wisconsin. That would be a question to ask our staff. I'm sorry.
Okay, then what are the policies or procedures with NARAL Pro-Choice as it relates to abortion trauma?
We are strictly an advocacy organization. We don't provide medical care. We do policy-related work.
Okay.
We're not a medical provider, so certainly we don't have policies related to the provision of medical care.
Okay. What are the policies then of NARAL Pro-Choice? What kind of policies do you have?
We have employment policies. We have a mission statement. I'm not sure what you're getting at here. I mean, we're a nonprofit organization that does policy and advocacy work. We do not provide medical care, so certainly we would not have policies related to the care of patients, which is, I think, what you're getting at here.
Okay. What is the mission statement of the organization?
The mission of NARAL Pro-Choice Wisconsin is to ensure that every woman has safe and legal access to the full range of reproductive health choices.
Okay. And within SAFE, how do you relate with abortion trauma?
There's been a number of studies that have been done about so-called abortion trauma, and quite frankly, those done by credible medical organizations such as the American Psychiatric Association and the American Medical Association do not find that there is a difference in mental health outcomes for women who choose abortion versus women who choose pregnancy.
There's a study out there that...
There are a number of studies out there that have been done on that, and that has been shown again and again by a number of credible medical organizations. If you'd like, I'd be happy to email you information. I don't have the copies of studies or the links here with me today, but I would certainly be happy to follow up this meeting with an email to you with those.
But do you validate that abortion trauma is a real life experience?
Again, I'm not the medical professional, but no, the medical community has not validated that based on the work of the mainstream, well-respected medical organizations.
So all of these abortion trauma victims out there that have testified and have support groups and things like that, they're not validated by your organization?
Well, abortion trauma isn't a diagnosis. If you were to look at the DSM, and I'm not a medical professional, but I have a degree in psychology, so that's why my mind goes to this. If you look at the DSM, abortion trauma is not a medical diagnosis, so I'm not sure who exactly you mean by abortion trauma patients. Certainly there are people who, we all make choices, whether we choose to carry a pregnancy to term or to terminate it. We're making a choice, and certainly there are emotional repercussions and emotional pieces to every decision we make. What has been shown is that the outcomes for the mental health and emotional health of women is not different between those who choose abortion versus those who choose to carry a pregnancy to term.
Okay. So I think what you're saying from your background, you have a psychology background?
Well, I have a psychology degree. I don't practice psychology.
So it's coping with the negative consequences. It's how they
I think you're
phase it as abortion trauma.
Well, I think you're putting words into my mouth
the
there.
negative consequences.
I don't think,
It's a question. It's a question. How do you deal with the negative consequences?
I think that there are negative and positive consequences to every decision that we make. And certainly for some people, the consequences of having an abortion are overwhelmingly positive. For some, they're more negative. The same is true for carrying a pregnancy to term. The same is true for having an unintended pregnancy. What I can tell you is that the body of medical research out there does not validate a difference between folks who choose abortion versus folks who choose to continue a pregnancy in the emotional and medical consequences. So I think that you're attributing negative factors that are not necessarily there, and certainly that the research does not support.
Well, then we would need to compare research because it does
Sure.
exist.
And
Trauma
as I
exists
said,
and the
I
negative
would-
consequences exist.
Sure, and I would be happy to forward to you information from the various well-credited, well-established medical and psychiatric associations supporting what I've said. So I will do that immediately.
And I can
after
do
this hearing.
likewise.
Thank you.
Thank you, Chair.
Appreciate that.
Thank you, Senator Lazick. And I believe we will also be hearing from people who have been traumatized later in the testimony. Senator Urbanbach.
Yeah, real quick, and this is probably a question for the Medical Society or Planned Parenthood, but are you aware of any webcam situations, webcam abortions in Wisconsin at all?
No, in fact, I do know, I can answer this. Planned Parenthood is not doing them here in Wisconsin, nor does anybody else at this time. In many ways, this is a solution in search of a problem, if that's what you're getting at.
Okay, thanks.
I have one just final observation. You know, I was reading through your testimony, and you know, I really take issue with your description of this as being something of a brave new world. In fact, I have your testimony here where a woman goes into an empty booth in an undisclosed location, quite literally in the middle of nowhere, and converses with a doctor via webcam. Then swallows a pill dispensed from a tube in this empty booth. So you're making this sound as though it's all fictitious, yet were you here a few minutes ago when we heard Susan Thayer describe exactly that scenario that she was a part of?
First up, the description that I give there came from some of the advocacy and news accounts that were published, so that's the image that was being put out there. I was sitting here for a testimony, and I don't believe that's what she described. She described somebody going to a Planned Parenthood clinic where there are medical professionals receiving a sonogram and having this appointment in the presence of medical professionals. She certainly didn't say they went to a booth in the middle of nowhere. She said that they came to her or other Planned Parenthood clinics throughout the state of Iowa.
Well, I wonder if we were sitting in the same room then, but that's fine. Any other questions?
I think we
committee
were.
members?
That's if you'd like me to
I
answer
don't
that.
think so, but there's always Wisconsin Eye, we can always play back.
Sure.
Any other comments? Questions? All right, thank you very much.
Thank you.
Next, I'd like to call on Mark